Assalamu alaikum students. Hope you are all doing great and staying safe. I am Dr. Ayesha Younas and today I am here to teach you waterborne diseases. Drinking water is a major source of microbial pathogens in developing countries that cause waterborne diseases. So if we want to control waterborne diseases, we have to make the drinking water pathogen free. Okay, and waterborne diseases cause more than 2 million deaths and 4 million cases of diarrhea annually, and out of 10, 9 deaths are of children, and virtually all the deaths are in developing countries. Water related diseases are of four kinds: waterborne diseases, water washed diseases, water based diseases, and water related insect vector diseases. Okay. Now, today we will talk about waterborne diseases. So, what are waterborne diseases? Diseases caused by ingestion of water that is contaminated by human or animal feces or urine, which contains pathogenic microorganisms. Now, pathogens are directly transmitted when the water is drunk or the water is used in preparation of food. So, the carrier is water definitely, but it can be transmitted directly when it is drunk or it is used in the preparation of food. So now coming to the pathogens that cause waterborne diseases, we have several types of pathogens like bacterial, viral, protozoal, and infect. Talking about viral pathogens that cause waterborne diseases, we have hepatitis A, hepatitis E, poliomyelitis, rotavirus that causes diarrhea mostly in infants. And in bacterial pathogens, we have typhoid, paratyphoid, bacillus dysentery, E. coli, cholera, leptospira. And in protozoal, we have amoebiasis, giardiasis. And in helminthic, we have hiatal disease, roundworm, threadworm. Talking about the diseases caused by drinking water, we have two categories for waterborne diseases. The first one is diarrheal waterborne diseases, and the second one is non-diarrheal waterborne diseases. So, among diarrheal and non-diarrheal waterborne diseases, diarrheal waterborne diseases are more common because most of the waterborne pathogens infect the gastrointestinal tract and cause diarrheal diseases. The most common causes of severe diarrheal diseases are rotaviruses, pathogenic E. coli, Campylobacter jejuni, Entamoeba histolytica, Giardia intestinalis, and Norwalk-like viruses. These are the pathogens that cause diarrheal waterborne diseases. Other than that, we have epidemic diarrheal diseases. Two diarrheal pathogens, Shigella and Vibrio cholera, are particularly infectious and can cause severe epidemics. Epidemic diarrhea, both shigellosis and cholera, can be triggered by natural disasters like floods or political upheavals that disturb the normal water supply. Say, you must have heard the threat of कि इंडिया पानी खोल देगा तो उसकी वजह से फ्लड्स आ सकते हैं. तो any natural or political upheavals that disturb the normal water supply can trigger epidemic diarrhea. So coming on non-diarrheal waterborne diseases, while most waterborne diseases cause diarrhea, a few important ones also affects other parts of the body. Like typhoid fever. Typhoid fever is a bacterial infection that is caused by the ingestion of Salmonella typhi bacteria in food or water and affects almost 17 million people each year, causing some 600,000 deaths. Other than that, we have hepatitis. Hepatitis is a viral infection, primarily A and E. Hepatitis A and E are caused by ingestion of fecally contaminated drinking water. Hepatitis A causes about 1.5 million infections each year, and that are mostly in children. So the next important disease in non-diarrheal diseases is polio. Polio is a highly infectious viral disease that mainly affects children under 5 years of age. You must have heard we give polio drops to children that are under 5 years of age. Polio virus is primarily transmitted through fecal-oral routes, so safe water and sanitation interventions can really help reduce the risk. Lastly, talking about leptospirosis. Leptospirosis is a bacterial disease caused by ingestion or bodily contact with water contaminated with urine of infected or carrier animals, especially rodents. The disease is difficult to diagnose because it looks like any other febrile disease and is often overlooked, but it is really important. It can be really important, especially after flooding, because in flooding, uh, contamination of water with the urine of infected or carrier animals is quite easy. Thank you so much. That's all for today's topic. And if you have any queries, you can ask me in the comments.